Welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much-needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. The Cancer Association of Greater New Orleans, or CAGNO, provides cancer survivorship through education, patient services, and research. In honor of Breast Cancer Awareness Month, Michelle Burtch will join us to talk about CAGNO's mission, which is to assist local cancer patients and their families by providing support that will enable them to continue their treatment. An important part of CAGNO is an organization called Breastoration that helps find financial assistance for women seeking breast reconstruction throughout the state. The group just hosted a fabulous event called DellaCroce Goes Pink. For our Community Health Heroes report, I'll take you to that party and tell you more about the important work that Breastoration does. And Eat Fit Nola, a nonprofit initiative by Ochsner Health System, has teamed up with Pigéon Catering and Events to bring more nutritious meals to students, offering Eat Fit prepared items on the menus of 12 local grade schools. In the kitchen for our cooking segment, Eat Fit Nola Ambassador Emily Eickoff will tell us more about this exciting new partnership, and Chef Geoffrey Rhode will tell us about some of his classic school lunch remakes, including Eat Fit mini pizzas on whole grain bagels or English muffins, and Chicken Tender Tuesdays, featuring grilled chicken strips with whole grain mac and cheese with the homemade cheese sauce that Pigéon Catering developed specifically for Eat Fit. All Eat Fit items are identified directly on school menus with the Ochsner Eat Fit seal of approval. Don't go away. We'll be right back with more Community Health Heroes.
145 over 92.
180 over 111.
I had a heart attack, a cardiac arrest, and then a stroke.
This is what high blood pressure looks like. You might not feel its symptoms, but the results from a heart attack or stroke are far from invisible or silent. Get back on your plan or talk with your doctor to create an exercise, diet, and medication plan that works for you. Go to loweryourhbp.org.
If I would have followed a treatment plan, I would not be in this situation.
Welcome back to Community Health Heroes. Did you know since 1958, the Cancer Association of Greater New Orleans has been the local leader in the fight against cancer? CAGNO, a nonprofit United Way community impact partner, prides itself in protecting and defending the community against cancer through education, outreach, research, and assistance of needy cancer patients. With us now is CAGNO's Michelle Burtch to tell us all about what CAGNO does and its many patient services programs. Thanks for coming on the show today, Michelle.
Thank you for having me. I'm very fortunate to be here today.
I wanted to ask you about the Cancer Association of Greater New Orleans and why you think it's such a special organization.
It's special because it's been started in 1958, and we have been the only local nonprofit that helps cancer patients undergoing treatment to basically ease their burden a little bit, help the barriers. And now we are growing, we're expanding to Baton Rouge, and we are now going to cover after 13 parishes, 23 parishes. And we are actually the only independent nonprofit of its kind.
That's a big jump, 23 parishes.
Yes, we're very excited about it.
Well, of course, October is Breast Cancer Awareness Month. So how does CAGNO shift gears for October and try to focus on breast cancer and education?
We also believe that with breast cancer awareness, we try to promote it every month, but we definitely try to especially promote it this month. What we do is we actually go into the different schools. We talk about breast health with a lot of the students. We actually have a health educator that goes in and talks about different things. We also are in conjunction with Restoration, which was founded by Kim Sport, and we're very fortunate to have that organization because we're actually able to help more patients undergoing reconstruction. And now we're able to educate more patients about knowing their options, because a lot of patients don't know their options. And Kim Sport actually passed a law that every hospital, every physician is supposed to give the patients their rights to knowing their options.
And in terms of the biggest obstacles facing women getting that breast cancer diagnosis, what do you think those obstacles are, and how does CAGNO come in to help?
We help more on a Also educational, but also on a financial base. Like a lot of women who are going through treatment, a lot of them lose their jobs. They don't have the money that they used to have. So what we do is we can help them financially as far as with gas cards to chemo. We help with wigs, mastectomy supplies, nutritional supplements. We also can help them with babysitting. You know, if they need extra money for that, or utilities or gas cards. And we also try to work with a lot of the different local organizations and try to help them to kind of, you know, form as a group.
A big part of CAGNO's mission is education, and I know you have specific tools for outreach for that. For example, we were talking about Restoration. I know there's this brochure. Can you tell us a little about that?
Yes, with the brochure, we actually distribute the brochure through across the state to all the different plastic surgeons and all of the breast surgeons to know that there is an option for women, and that a lot of people in Louisiana, as long as you have your surgery in the state of Louisiana by a Louisiana surgeon, we can help you with your reconstruction. We also work a lot with Susan G. Komen, where we're able to help women actually fund more for when they're undergoing treatment with breast cancer. And we actually are now partnering with the LSU Cervical and Breast Center, and we're really excited about that. We're gonna help women do diagnostic testing as well.
Gotcha. Focusing again on Restoration and education, that brochure, I found out that it looks like a lot of women don't know that reconstructive surgery isn't something that's cosmetic. It's actually a medical necessity, which I think, according to your statistics, a lot of women don't know.
And that's what it is. Actually, it's 1 out of 7 women do not know their options. And that's why it was very imperative, even when Kim Sports started this, and then also we're trying to advocate more for it, that it is a state law now to have, you know, basically if you have a mastectomy, your insurance is supposed to cover your reconstruction as well. And by law, your physician is supposed to tell you your different options as far as it's either prepectoral breast reconstruction implant through D-flaps. There's so many options women have, but they're not being told. You know, I feel like when women are going through cancer, they're scared. They don't know what to do. They are just asking their doctor what to do. And so we're trying to help the doctors become more informed that they're able to give their patient their options. And the patients should be their own advocate and ask their doctor, what are my options? And they should know their options.
I know a big part of what CAGNO and Breastoration does is fundraisers and raising money, because you have a lot of worthy people out there, I'm sure, applying for help. Can you tell us a little about your fundraising efforts, and especially about your online store, which I got a chance to look at?
Yes. One of our biggest fundraisers for Breastoration is Galatoire's Go Pink, which we just had, which was wonderful. It's always a sold-out event. They close Galatoire's down on Monday, and it's just, everything is pinked out, and it's wonderful. We have local, a lot of the hospitals participate with us, from the Center for Restorative Breast, Ochsner, East Jefferson, and local physicians that are here. Basically, it's just to raise funds for women with reconstruction. We also do different events. We used to have the Bodacious Bras for a Cause, and it's where women, they decorate their bras and different things. We're very grateful to Diane Lyons, who started that with Festa Gals. And we also do different events. I actually started this event called Cocktails for a Cause, which we get bartenders to go behind the bar, and they actually bartend, and then the tips go to helping women with breast cancer too as well. It's a great fun.
Can you tell us a little about the fundraising efforts? Because I know there's the cool note cards online in your online store, and there's a book too, is that right? Yes,
we have a book called The Many Faces of Breast Cancer. You can go online and purchase it. 100% goes directly to helping CAGNO and your patients undergoing treatment. Also, Jane Goldring's sister passed away of cancer, and she made these beautiful note cards in memory of her, and 100% goes directly to helping cancer patients. And usually we just try to fundraise. A lot of people actually come to us. They realize that we're a local nonprofit, and 100% when they're raising money goes directly to helping cancer patients. So we have from CrossFit to different restaurants that come in to Mazzatos. Like we said, we did Cocktails for a Cause. We have Breastoration. We have a lot of different festivals, like in different local, like even Cobain and Associates did abroad and raised $5,000 for us. So it's just, it just depends on, you know, and now we have a new also fundraiser too with Steve Herman, which we're excited about in November. And so we're just trying to get the word out there, and we just want people to know that when you do a fundraiser for us or you try to help us, it goes directly to helping cancer patients undergoing treatment.
For some of our audience members who are listening and may think CAGNO is a resource that they want to reach out to, how can audience members reach out to CAGNO? Is there a website you can tell us about, and also about a little about the application process? Is it lengthy, or can you find it on your website?
Absolutely. If you go to www.cagno.org, we have all the information there. You have from patient services to Breastoration and different things. The application is right there. You just download it, you fill out the application, and then you just fax it in. You can drop it off at the office. We also have a lot of social media presence as far as Facebook, Instagram. So you can definitely follow us, and that's where you can find out about the fun events and the fundraisings for breast cancer awareness. As far as with the application, if you have any issues with it, we do have a patient educator in the office that is willing to help you walk through it and to help you with anything you need, because it is a little bit lengthier, because we just want to make sure that you are undergoing treatment, because we're trying to help as many patients as possible. We're trying to give, as much as we can to helping more people in the local community.
Right. Well, this was really informative. Thank you so much, especially being so passionate about this cause.
Yes. Thank you so much for having us. We're really excited.
Thank you. When we return, I'll take you to that glitzy Breastoration fundraiser at the world-famous DellaCroce restaurant that turned pink for an evening to celebrate an important mission in our Community Health Heroes report.
Well, Thomas, you've got pre-diabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have pre-diabetes. Big time.
Welcome back. Did you know reconstruction following breast cancer surgery is not cosmetic surgery? It's actually medically necessary. Federal and state laws require health insurers, including Medicaid and Medicare, to cover breast reconstruction procedures. The problem is that fewer than 35% of eligible women undergo breast reconstruction because a staggering 70% of women, particularly poor minority women, are simply not informed of their reconstructive options, do not know they have insurance coverage, or do not know where to gain access to the procedures. Restoration hopes to change all that by spreading awareness and education about reconstructive breast surgery in Louisiana. And earlier this month, the focus was on raising money to help women all over the state at a fun and festive event called DellaCroce Goes Pink in our Community Health Heroes report. Breastoration supporters attended the DellaCroce Goes Pink fundraiser on Monday, October 1st at the world-famous DellaCroce restaurant. Everything was pink. From the fanciful decorations, to the gourmet menu, to the signature glassware. And those in attendance for cocktails and dinner were flush with donations to give to a worthy cause that collected more than $100,000 that night.
There are a lot of worthy organizations that assist women with breast cancer. They're focused on finding a cure, prevention, early detection, and then there are a lot of other organizations that deal with the back end of breast cancer, trying to help women adjust to the new reality of being a cancer survivor. And we are in the middle. We help with the surgeries. So if a woman has to undergo any type of breast cancer surgery, we make sure that we provide them with all the information they need about their surgical options, and then we educate them about the availability of insurance coverage for the different types of breast reconstruction that are also available to them.
Kim Sport is a 3-time cancer survivor and co-founded Breastoration to help breast cancer patients access the treatment no one talks about, breast reconstruction following surgical mastectomies. Breastoration, a fund operating under the auspices of CAGNO, the Cancer Association of Greater New Orleans, provides educational brochures to thousands of women and healthcare professionals to make sure that every woman is informed about surgical and treatment options at the time of a breast cancer diagnosis. For every $5,000 raised, Breastoration helps one woman avoid lifelong disfigurement and receive a specialized surgery she could not otherwise afford. While CAGNO hopes to distribute this information nationwide, the biggest push for dissemination of the Breastoration brochures is in Louisiana, which has one of the highest mortality rates in the nation for breast cancer.
Your support of Breastoration makes a real impact in this community. It's tangible, palpable, and visible. And this event is, without doubt, the best way to kick off Breast Cancer Awareness Month.
WWL-TV anchor, reporter, and radio talk show host and breast cancer survivor Angela Hill was this year's event honorary chairperson.
You know, I'm still stunned by the number of people who have breast cancer. I call it an epidemic. I'm not sure it is. I just know that if you haven't been diagnosed, you know somebody who has. That's a lot.
Breastoration's mission is to create awareness of surgical options for women diagnosed with or predisposed to breast cancer and help them afford the critical final step in their physical and emotional healing. Honorary Chairperson Angela Hill got emotional praising the group.
And thank you for organizations like Restoration that care, that just want women to have every opportunity we can. I toast Kim and that entire group around you for bringing this to us. Thank you, and thank you for being here for a wonderful night and to support us. Thank you.
When we return, how one popular catering company is collaborating with Eat Fit Nola to bring healthier lunches and snacks to school kids throughout the New Orleans area.
I guess sometimes things just happen. Devastating things. It's got nothing to do with fairness. Bam, your whole world changes in an instant. And you never see it coming. That's what happened to me the day my mother had a stroke. I'm Paul George, and I want you to learn the signs of a stroke fast. F-A-S-T. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Because the sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Protect the ones you love. Spot a stroke. F-A-S-T. Fast.
I'm Molly Kimball, registered dietitian and founder of Oxner's Eat Fit Nola. We've collaborated with more than 100 partners locally to create Eat Fit Nola, a partnership that highlights the better for you items right there on a restaurant's menu or on grocery store shelves, making it effortless for you to dine at your favorite restaurant or shop your favorite market without ditching your otherwise healthy diet. Every month, Community Health Heroes Show, which is sponsored by the United Health Foundation, will shine a spotlight on an incredible chef to help show you how you can make smarter food choices to live a healthier, happier, and hopefully longer life. In addition to Eat Fit Nola, you can find our partners such as Eat Fit North Shore, Eat Fit BR, Eat Fit Bayou, and coming soon, Eat Fit Acadiana in a neighborhood near you. So don't go away. Community Health Heroes will be right back.
Don't you wish your lunches today were like the ones you used to eat in school? There were hamburgers and hot dogs, pizza and pasta, and lots of desserts like cupcakes and ice cream. While some schools have tried to provide healthier lunches and snacks to their students in the last few years, a new partnership is formed here in New Orleans that is bringing a more gourmet and good-for-you spin to some old-time school lunch favorites. Chef Geoffrey Rhode with Pigéon Catering and Events is joining us today to show us some of his new school specialties, and Eat Fit Nola ambassador Emily Eickoff is here to tell us about this exciting collaboration. So thank you both for joining us today.
Thanks for having us. We're excited to be here.
So Emily, how did these two groups come together? How did Pigéon Catering come to you, or did Eat Fit Nola go to Pigéon Catering?
Yes, so we're so excited. This has been something in the works for several months now. We have 12 schools now that offer these delicious, healthy items. And, you know, looking at what was there before, what I even ate in school, it looked kind of like boiled mush, you know? And so this looks a lot more visually appetizing, and it's a lot healthier for you as well.
And Chef Jeff, tell us what you're going to be cooking today.
Great. Actually, I'm going to tell you while I start.
Okay.
So we're going to cook today is an Eat Fish dish that we work close with Eat Fit Nola with Molly Kimball, and it's a chicken Alfredo. Now we're featuring this in a lot of our schools. The menu always rotates, so every day in all of our schools we have a handful of Eat Fit items. So today we're going to do a chicken Alfredo pasta. So we're going to start with some grilled chicken breasts. Now what's great about this is with Eat Fit, you put as much vegetables as you want in anything. And so that is like so cool. And we use a lot of lean proteins, absolutely whole grain, everything. But you can still use a little bit of fat. You can still use a little bit of salt. You just have to have a light hand with it. So what we do is just make sure that we develop lots of layers of flavors, and that way we can cut down on the salt and the fat.
So when you were choosing the dishes that you were going to create for this, what inspired you? Were you thinking back when you were a kid in school, would you like to eat?
I really was. And again, when I was in school, which was a really long time ago, but the food was just, it just wasn't memorable, loaded with calories. So now it is so cool to go into schools and see fresh vegetables. All my vegetables are always brown. So yeah, so we developed a handful of sauces.
Huge props to you for really, we gave him the specifications and he came back and he said, how is this? How is this? How is this? And so it has been a dream working with Jeff and Pigéon for Eat Fit.
Oh my goodness, look at this.
And so you see, it's almost like a primavera. So we have our Eat Fit sauce, and we have lots of veggies in it. Again, we're still able to put some cheese in it, but we source a low sodium cheese, a lower fat cheese. We're still able to put even butter in some things, as long as we just put a little bit of it. So we're able to get the flavors, the most important thing is that the kids eat this. Because if they don't eat it, then this is all for nothing.
Exactly.
So we've worked really hard to make sure we also go to the schools and meet with the kids. And it's so funny, some of the stuff they tell you. If they don't like it, they'll tell you about it.
They'll tell you.
They will.
Well, I'll tell you, as you were saying, it's very visually pleasing, and I think it's because you always say, Emily, about the colors of the foods. You're supposed to eat colors of the rainbow, and you see a lot of colors in here, so it looks fun to eat.
It's true.
Adds so much. And if you think about, the stress that high schoolers are dealing with, they have their schoolwork, and they don't need to be calculating their calories for their lunch. Let us take care of that for them, and they can, stick with their extracurriculars and really focus on the important things,
And in terms of nutrition-wise, could you tell us a little about this?
Yes, so the chicken Alfredo is around 600 calories, which is a great entree, especially for a growing teenager. And it has about 40 grams of protein, which is huge. It'll keep them full for a long time. Lots of fiber with the whole wheat and all that. And then you have your rainbow colors. So we love the rainbow.
And I'll tell you, for kitchen cafeterias, school cafeterias, that looks like a pretty easy dish to prepare,
well, that's
right?
important too, because it doesn't matter what we do in the test kitchen, we have to have the people at school be able to execute it. And all the schools are a little bit different, so we just work closely with it. We do a lot of training, which is important. This is all about information, and for us, changing habits, which is a big thing for us.
So while this is cooking, could you tell us a little about some of the other things that you brought today?
Well, we do lots of Eat Fit items. So this one is actually an Eat Fit mac and cheese. So this was a tricky one to work on, because mac and cheese needs to be, you got to love mac and cheese. So we started with the whole grain pasta. We sourced some really good cheese, again, low fat, low sodium cheese. And the battle was won once we sourced those ingredients. We're using milk instead of cream, actually 2% milk instead of cream. The spices, I'm going to put as much spices as I want in it, because that doesn't count. So this has been very popular. Now, again, we talk about Pigéon, we talk about Eat Fit, but we also work with other local businesses. We work with local bakeries, and that one of them helped us to develop this Eat Fit bagel.
So the whole grain bagel thing, I was thinking, I love pizza, and I guess it's easier to eat the whole grain bagel if you put a lot of yummy sauce and stuff on top. So I see there are 3 different toppings here.
Okay, and so for us, we have our marinara sauce that we make, which is it's an Eat Fit marinara sauce. It's it's got mostly tomatoes in it, olive oil, lots of herbs, some onions. So there's really nothing bad in the marinara. So again, we lightly top it with cheese, and then at that point we can have basically 3 ingredients on it. We have a turkey pepperoni that we have sourced, grilled chicken, that's protein, rainbow veggies we can put. So we have some fun with the toppings on that. Now this last dish I'm super excited about.
This one looks so good.
Every month we're doing new features, and we're going with fruits and vegetables that are in a season. So any given month in a school, the fruit of the month might be berries, it might be peaches, it might be plums, so they're not just getting an apple and a banana. But this month we're going to do a butternut squash bisque. And we're going to run it the second Friday and the last Friday of the month in all of our public schools, and I think some of the other schools too. And so it's a butternut squash bisque, which has not much going on in it. Some onions, some shallots, got a little olive oil, and a lot of butternut. We finish it with just a touch of cream, and it has a lot of fall spices in it. It's got a little cinnamon and nutmeg and ginger.
Perfect for
the season. It's kind of like a holiday soup, and we're going to pair it with a grilled cheese sandwich.
Looks perfect for dipping, huh?
Yes,
it
is.
Looks so delicious. In terms of you talking about your test kitchen, tell me what it was like having kids test this out. Did you go?
It's actually fun too. They are not intimidated.
No, I don't think
and so some of the questions they ask, so we actually do focus groups. So we'll go into schools and we'll pick out a dozen kids and we'll just make a bunch of items and thumbs up, thumbs down. We'll try to make it fun. And the feedback is very, very valuable. Because, you know, sometimes you're surprised by the stuff that they do like. Like, they like a lot more stuff than I thought they would.
Really?
Oh, when I was a kid, I wouldn't eat a vegetable till I was, 20 years old. But now the kids, I mean, they're crunching on raw veggies and they love it. It is so cool.
Well, Emily, why is it so important to get kids starting to eat right now in school? Like, why do you try to target that?
I mean, I think it's one of the most important populations to target because it really is going to influence, these kids are going to be our doctors, they're going to be taking care of us. So let's give them the best health education, the best nutrients to grow, strong brains and everything needed to, be contributing members of society. And so I think children are a great population to target for healthy eating.
How are kids and parents going to know about this? How are they going to know what items during lunchtime are Eat Fit NOLA approved?
They can find all of the Eat Fit items on our Eat Fit NOLA smartphone app, and they can find out all the nutritional information as well, from the calories to the protein, and it will show you exactly what school, what day of the week this item is going to be featured and all of that. Really cool. So it's very interactive, and you can find out, okay, what are they going to have on Wednesday morning for breakfast? What's that option? And they have hard-boiled eggs and yogurt and things like that as well. So.
And I know Eat Fit NOLA has an exciting announcement about Voodoo Fest. Could you tell us what's going on at Voodoo Fest?
So at the end of the month, Voodoo Fest happens each year. It's a music festival, and so we're so excited that we're going to have Eat Fit options there available. So.
And I believe you did that once before with French Quarter Fest, is that right?
We did it with French Quarter Fest. We were at Bayou Boogaloo, and so, it's really, I love the school food program because it shows kind of the evolution of the Eat Fit program. We started at restaurants, and then we slowly made it into festivals, and now with this school, we're just taking over, it feels like. So
that's why we're excited at Pigéon Caterers. It's just a perfect fit for both of us because it just all came together. We are in the food business, and we've been catering forever in the city, and now we have all these healthy offerings, and we're working with the nutritionalists and the dietitians, and we're making our food healthier, and I think it's just a great fit.
Tell me a little about Pigéon Catering and Events. Where can people learn more about it?
We you can see Pigéon Caterer. It's on the internet. You can look at our website. We've been in the city for almost 20 years now. It's a really big catering company. Recently, we've moved into manufacturing, again, which helps us to be more vertically integrated. So all this school food, we're making it ourselves in big batches, making it, getting it out to the schools the next day. So it's a local company in New Orleans proper, all local employees. It's a big company, and it's a fun company to work for. And we do all sorts of stuff.
And how about Eat Fit NOLA? How can our audience members find out more about it?
Of course, they can always go to our website, eatfitnola.com, or download our free smartphone app in the App Store for both Android and iPhone. So lots of good resources there.
Well, thank you both so much for coming today. All this looks fabulous, and again, hopefully I'll be able to get first dibs on this cheese, everyone. And I know that we'll be posting the recipes on our Facebook page and, of course, on communityhealthheroes.org. So thank you both very much.
Great. Thanks for having us.
We'll be right back.
Listen, I realize that I'm not perfect, but it all really started to change because you judge me for having a problem. No one is going to know that I need help. I need help. I know that no one is going to judge me for having a problem. I realize that I'm not perfect, but it all really started to change because you listen.
Thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurants, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org, and you can also find our show on YouTube. We hope the information we provided you about the programs at the Cancer Association of Greater New Orleans, how Breastoration helps inform women about reconstructive surgery options, and how Pigéon Catering and Events and Eat Fit NOLA are offering healthier lunch options at many local grade schools will help you and your family live healthier, happier, and longer lives. I'm Leslie Snedowski. Make sure to join us next time for more Community Health Heroes.